I'm just a Michigan-made girl who survived major trauma after major trauma. I moved all over the country in the United States, north, south, east, and west. But it wasn't until I found myself wanting to end my life right smack in the middle of the country that I realized I could no longer run from the pain of my past. I needed to heal it so I could have the future I deserved and longed for. Now I speak on multiple stages and pages about how to turn your tragedies into your triumphs. Here I have fantastic specialists and guests to help me on that journey, to help people not only around the country, but now around the globe. I'm a speaker, podcaster, coach, and author, but most of all, I am now a victor in my life. And now my mission is to help you find the victor in you.
Welcome to Multiform PTSD. Here's your host, Tracy Lowry.
Our guest today has years of experience as a registered psychiatric nurse working in the psychiatric emergency, the urgent mental health, and community mental health. She discovered the importance of alternative medicine as an addition to a person's overall mental health care plan, which is when she decided to become a Reiki master and join the two worlds. Today, she talks about when it's time to seek help, steps you can take to improve your mental health and mindset today, and so much more. Please help me welcome, as we celebrate nurses during Nurses Week and Month, Miss Lesley Evans. And here we are today with Miss Lesley. How are you today?
I'm great. How are you doing, Tracy?
I'm good. Thank you so much for being here today and helping us celebrate nurses all over the world, but especially this week during Nurses Week.
Mm-hmm. It's nice to have a week to be recognized.
It does. It
Yes.
does. Absolutely. I don't know if you know, I'm actually an RN myself.
I remember having that conversation when we first started to talk. Yes.
Yeah. So I have a kindred soft spot for other nurses as well.
Yes.
So when Nurses Week comes up, I'm like, you know what, we're gonna celebrate nurses. And I love that there are many different niches as far as what nurses can do and where we can serve. Thank goodness we each have our own niches that we enjoy, because I love that you are a psychiatric mental health nurse as long as practicing Reiki. I love that you combine the two, and I want to talk about that. Originally, when I was in nursing school, I thought I might go that route. And after school, I went to the cardiovascular telemetry angle and love that. And I, want nothing to do with the psychiatric side of things now. Isn't that funny how, we think we're going to go one way and it just goes another.
It's very interesting how that happens. I know I was all about trying to do the medical piece as well. And then it was like, no, this is where my heart is. And so this is where I need to be. And it just, synchronistically just leads you in that direction.
So true. And I'm so glad that there's nurses that like what you like and that I like, and that we all have our own little niche. So thank you so much for being here. You've got extensive experience, it looks like, from different angles, maybe, of the psychiatric specialty.
Yes.
Not only the traditional medicine side of things, but also alternatively. And I love meeting other nurses and medical professionals that believe in incorporating the two. I feel like sometimes each side tends to be anti the other side. And I truly think they both have their own place. And if we work together, we can get so much more accomplished. So thank you so much for bringing both sides with us today to help out those who may be struggling or love someone who does.
Mm-hmm. I agree wholly that this whole medical model versus alternative model, just like, they just butt heads so often. And honestly, it's really the meld of both of them together that just encompasses the whole person. And there are great things from both systems, but together they're better, they're greater.
Yes, I totally agree. And my healing, both physically and mentally, it took both of those worlds. to help me in my healing. And I would not have been able to do that without the other one. I think it was the two put together that really helped get me back on my feet. And so thank you for being our spokesman and helping us out with that. So let's go ahead and dig in, shall we?
Sure.
So tell the listeners a little bit about what you do. We talked about kind of your niche, but what's your experience with, mental health and mental illness, both traditional medicine and alternatively? How do you help with that?
Okay, absolutely. So I am a registered psychiatric nurse, which is something that's only in the Western provinces in Canada. And I have been working as a psychiatric nurse for 30 years this year. I can't believe how long that is.
Congratulations. Wow.
Yes, it's been a while. And I've worked in the public health system for pretty much since I graduated in 1991. And so I've loved that. I've loved that piece. Over the years, things have happened in my life that caused me to kind of sit back and look and think, is this enough? This medical model, the giving tools or medication or whatever, is this all there, all there is? And so personally started taking some of those things for myself, the self-development piece and self-development world. And then, I don't know, like just over a year ago, I got vertigo and I'm not able to do that frontline work anymore. So really dove into that and really learned a lot more about that energy, the Reiki, and now soul records and just how they work together. And so it's incredible. I've worked in residential mental health. I've worked in psychiatric emergency. I've worked in urgent care, in community mental health. So I've worked all through the public healthcare system as a psychiatric nurse therapist. So I've taken on more therapy roles than the sort of traditional nursing roles. Okay. And often as a nurse, we work with more complex cases. So people that have more than one diagnosis, sorting that out, and a lot of case management as well as that therapy piece. So yeah, that's what I've spent my 30 years doing in that public health system. And so more recently with vertigo, I'm not able to do that frontline work. So I delved more into this energy alternative therapy. And honestly, I only see potential and more potential for these two worlds to meld together. And so I started to develop programs in that. And I wrote a book. Awesome. I don't know if I told you that, but I wrote a book called Defunk Yourself.
Defunk Yourself?
I actually defunk yourself.
Love it.
And it's tips to guide you out of the funk you're in. And I really sat down and, in the beginning, you go over that anxiety about if this is going to get better, the guilt over not being there for your clients that you've been there for years, and then COVID coming and feeling even more guilt knowing that everybody was going to need me, but I couldn't be there. I thought, how can I contribute? So I thought, I'm going to write a book. And so I sought the help of a mentor, and I finished the book, and I just published it last week, which is exciting. Yeah. And I'm an international best-selling author, I guess. So.
I love it.
So who knew that was going to happen? So it's really just a book, simple tips, because I really truly believe that simplicity is where we need to start when you're in that funk. That so many times I hear people talking about, I've got to do the deep work, I've got to do the trauma work, I've got to dig deeper. And honestly, yes, that's important. And we need to start with the simple steps to know that you can cope with all those emotions and those triggers that are going to come up when you do that big work. Yes. So that's what my book is about. Simple steps to just start moving forward and getting out of the funk you're in. And so I'm developing a program with that to teach some people. It's sort of that cognitive behavioral therapy kind of work along with the alternative therapy. So I'm excited.
That is so
Thank you.
awesome. So awesome.
So yeah, it's, life is different not doing the front line,
Mhm.
and not being there right in the trenches, and learning how you can contribute outside of what you've been used to.
And I think the good news about what's going on with the pandemic and all of that is we are learning to maybe be a little more flexible, and things maybe don't look the same as they used to, which means the way we approach it can maybe be different than what we're used to. And whatever our situation is, I love what nurses are about so often is just stepping up and taking care of the collective and taking care of the individual however we're needed. And you were
Exactly.
unable to do it in the way that you were used to, so you turned it around and did it in another way. And I think that's beautiful, especially with mental health, because right now I think mental health is one of the side things going kind of askew with all of this going on. There's extra support that is needed. And unfortunately, I think there's maybe less help right now in the mental health field as well, which is also why I wrote my book too. I love that there's a way that we can still help. And I really love that, especially, I don't know how it is so much in Canada. Here in the United States, some areas are better than others, but if you start getting out of the larger cities, mental health in general, there's not a lot of resources. So I think you're right on with how you decided just to turn it around and help in another way.
I couldn't agree with you more in that I often refer to mental health as sort of the poor cousin in healthcare.
Yeah.
and
Yes.
and rural mental health is even the poor cousin of the poor cousin. And where I worked in rural mental health, honestly, we do the best we can, and the people there are great and working hard and they care about what they're doing, and there's still no more resources needed.
Yes.
And that's one of the things when I was looking at the questions you were asking is, when you're looking for things, don't let the system keep you from continuing to kind of access, because there's people that really care about what they're doing, even though the system is sometimes hard to navigate.
Yes.
So yeah, there's definitely work that can be done in mental health for sure. And so I'm happy to contribute in the way I can contribute right now.
I love it. So I would love to pick your brain a little bit on when you were in the front lines and you were in, the emergency room and the acute care and urgent care. That can be a very different world that maybe some aren't aware of what that might look like,
Mhm.
and how to help. I know many people who have had to use those kind of facilities and resources. And a lot of times they feel like once you hit that point of needing to go to a mental health psychiatric emergency room or hospital or facility, that they're a lost cause, that they're crazy. There's no help or hope once you get to that point. And so I feel like sometimes that's what stops people from going to get that help, is because they don't want to be, marked with the stigma or feeling like a failure, or like that's the end and there's no place to go further. Can you kind of talk maybe on maybe some of the success stories you've dealt with, and that it is work and there's a process to work through it, but there is light on the other side? As someone who worked on the front lines, what can you tell people about maybe that angle?
So my experience is, and I always tell clients, don't hesitate to go in. You don't have to be at the end of your rope to go in.
Right.
It's not, it's not you don't have to wait until you can't go on any longer. Go in, seek that help. I think one of the questions I'm most asked in urgent care is, am I going crazy?
Yeah.
And I think for me, one of the things that I have found most validating for the people that I see is to say, no, no, you're not. When you think of what you've gone through, whatever it is, that the stressor or the trauma that they've gone through, you're not sleeping for days, you're not thinking straight. It's no wonder you're feeling the way you are. And so to go in and just have that validation to say, no, this is exactly what we'd expect in this situation with what you've gone through. And we've seen it before and we know how to help you. So I think that is probably the biggest thing for me is the validation that, yes, you've had some big things happen, and that, yes, these are the symptoms that are normal for what you've been through. Right. We have things that we can help you with. And so just go with us. It's normal. It's normal for what you've been through. So that's the biggest validation. Now there's two sides to that. There is the people that are in a psychiatric crisis. So more of that mental illness where they're in an acute part of their mental illness, where really that is the only place to go to be safe, to get that treatment, because the longer you go without treatment, the harder it is to treat it. So just like any physical, if you leave your diabetes go for years and years and years, it takes a lot longer to get it back on track.
Yes.
Right? If you leave your heart disease, it's harder to treat. It's the same thing with if you have a psychotic illness of some sort, like schizophrenia, or that the manic piece of the bipolar, or anything like that. If you leave it without treatment, and the longer you leave it, the harder it is to treat. Right. So, seek the treatment. I know it's hard and I know it's scary sometimes. I mean, you got to remember that the people that you're seeing in Emerge are doing it because they love it, and they really believe in what they're doing, and they want to help you. And for me, the other thing that I say, it isn't always mean that it's an admission.
Right.
Sometimes it's that first contact that you have in the mental health system that connects you with the people that can help you. And you don't necessarily have to be in hospital. In fact, my experience has been that we don't like to admit people unless it's necessary. Absolutely. And that hospitals and psychiatric units are there for a reason. And it's a good reason to have them. But it's not a place where we just admit people willy-nilly. Right. It's there for a reason, and there's lots of other resources that you can access going into emergency or urgent too, other than just admission to hospital.
Beautifully said, because I agree. We talked about earlier how different, as far as nurses go, how we have different passions, and that's why we work where we work. And so you spoke on that. The people who are there working in those facilities are there because it's their passion, or it's something that they care about. They believe in what they do, and they're doing it for a reason. I think that's huge. And I think especially when it comes to mental health, that's one of those specialties that you only get into if it's your passion and it's something that you truly, truly love. It's like being an OB nurse or a pediatric nurse. If that's not your passion or your thing, you're not going to get a job there.
No, and you're not going to stay there.
No, exactly. So that's a great point to say, hey, those that are there, they're there because that's what they do. That's what they specialize. They care. I think that's huge. I know a lot of people get so nervous about going in, and they're afraid they're going to be, what they'll call locked up. And there are times where that is the safest thing for you to do for yourself, where you got to just take a time out. You got to work on yourself. But if you go before you get to that point, often you don't need that. There's just other resources that you need that you don't know about yet, that if you go in and get help, you can guide them to those different places. So thank you for speaking on that. I'm hoping people are listening and taking note that sooner is better than later, because like you said, the sooner you do it, the less long it will take to work through, the less hard it'll be. If you wait till you hit rock bottom, unfortunately, which is exactly what I did, it's just a mess, a long journey. It's still possible. It still is something that you can work through, of course, but it makes it harder. So moving on then a little bit to, obviously, if you need to get that help, go get that counselor, that psychiatrist, the medication, get that medical help if that's something that you absolutely need. Now, being the Reiki master that you are, how can some of the alternative options also be helpful?
So the first thing I'm going to say with the alternative therapies is that I think you'll hear less from that alternative world that you can only do this, because that's not the way it works, especially with Reiki, is that it works well with the treatment that you're seeking, that we want you to keep seeking whatever treatment you're seeking from a medical perspective or a mental health perspective, and that Reiki works with that to help that healing. So I believe in therapy and in mental health support. That's what I've done for 30 years. And I would have never gone into Reiki if they said, no, you can only do Reiki and not the rest of it. If you're hearing that, then you're not in the right spot. Reiki is about adding to what you're already doing. And so for me, Reiki is it's energy. So everything is energy. Energy surrounds us. We get from energy, we give to energy. Even the table that is wood has little moving molecules in it. It's energy, right? For me with Reiki, it's really, I'm just that conduit for that universal life force energy. And people have lots of different words for that, whether they call it spirit or Mother Earth or God. In whatever way you describe it, it's really the same thing we are accessing. And like I said, it doesn't matter what you call it, it's there, it's accessible for everyone. You don't have to do anything special to deserve it or to bring it in. It's just waiting for you to say, let me in and let me help. So with Reiki, it's amazing. So with Reiki, I'm able to just be that conduit to, let that energy in, and I can do it distance or in person, which is nice with COVID right now.
Right.
And the energy, the universal life force energy, goes where it's needed most. I'm not the one who directs the healing. I just help the energy. I'm just a conduit for the person to accept the energy and let it do its thing. So it will go in your body, in your brain, with your anxiety, with your depression. It will go wherever it's needed. And so that's what I love about it. It's not replacing anything. It's helping. It's adding to what you've already got going on. So it's really cool.
Yes. I love that it's in addition to. If you can get to someone who does Reiki or other energy work or alternative work, if you can get to them early enough, maybe you don't need to go on medication. It can be a good preventative thing to do as well. So you don't get to that point of high acuity time. It takes more time. But if you can do it beforehand, it could be really helpful. So if you know that you are having, like you said, anxiety or depression, or you know that you've been through some kind of trauma that and maybe it isn't bothering you yet. I know a lot when I had my complete mental breakdown, there were things that were coming up that I hadn't thought about in over decades. And there were things I didn't even remember until I was going through that then I started getting those flashbacks and those memories back because I was very young. And I had no idea. So if you know that you have those things, take care of them sooner rather than later, because if you don't, I have found time and time again, they're going to come. They're going to present themselves, and they're probably not going to be in the way you want it to, the time you want it to. So you can kind of I hate to say control the healing, but you might be able to control a little bit how you're able to heal and recover from it if you do it sooner rather than later.
I agree 100%. And the easiest way I can compare it to, because people really resonate with the medical or health things, if you start taking care of your diet before diabetes shows up, then you don't need the diabetic medications or insulin.
Right.
If you are on insulin because from a child you've needed it, if you take care of that along the way, you need less treatment. You need less, looking after, because you're looking after that health. It's the same thing with any kind of mental health. And And really one of the things that I think is so important, and I was just talking to a couple of people today about building that awareness of those things. Like you said, suddenly I was having thoughts and my mood and all of those things. And so building that awareness of where your moods are at a given time, so that you can start figuring out, okay, so not just the mood, but even rating them from 1 to 10. So I'm happy at a 7, or I am sad at a 6, or being able to do that on a regular basis, so that when you start to feel a little off, you can go, oh, like I'm feeling frustrated and it's getting to a level of a 7. I've got to do something about this now before it gets up to that 8 or 9. So that awareness is such a huge part of it. You know, the mood awareness and your thoughts awareness and just what you're doing, all of those pieces are the first step, is just being aware where things are at.
Right. And to go to the medical side of things, those who have been in a hospital, maybe just had surgery or whatever, what is the first question we usually ask when we enter the room? We ask them to rate their pain level. And I have tried to preach time and time again, don't wait till you're at a 10 to tell me, because then we have to fight to get that pain down. If you can tell me when we're at, 6 or 7, I'd rather keep it below that, so we aren't fighting it. We can just maintain it. And it's the same thing with our mental health and those emotions that you spoke on. It's, you got to catch it before you get up to that point, because then you're not fighting it. You can kind of just maintain, lower it, keep it kind of in the lower levels. If you wait till you're at a 10, it's a whole lot harder to get it back down.
It's way harder to get it down at a 9 or a 10 than it is at a 5 or a 6, right? Yes. And you can just feel like you're losing control when you're at those levels.
Yeah.
And so that awareness, and like you said, and I thank you for that analogy. I love that analogy of the pain and rating the pain scale, because it's the same thing. Like, tell me when your anxiety is coming up, and then we can talk about the tools that you can use to bring that anxiety down. Right. So that you can, when you're on your own and you're not with me, then we can, you can use those tools again. So yeah, it's a huge thing, that awareness, and even that rating scale is just a great tool to use.
Yeah, I agree. So while you are working with people, what would you say would be some of those tools to help get the ball rolling?
Okay, so I think because we've been, talking a lot about mood, I think one of the things that we look at is, how do you bring your emotions down in the moment? How, so you can think better, because when your emotions go high, you kind of go into this, we often call it a reptilian kind of state, where you're not thinking correctly. You can hear this a lot. I was so angry, I couldn't even think straight, and I just blew up.
Yep.
So when your emotions get high, whether it's anger, sadness, anxiety, any of those things, your brain freezes. Because you don't have oxygen in there, because your body is going through this whole survival instinct, that flight or fight or freeze mode.
Right.
It's really important to try and start bringing that oxygen into your brain, so you can start thinking properly. And I know, I'm sure that lots of people have heard this, breathe. And not again, not the breathing. Yes, the breathing.
Yes, the breathing.
It, because your head will tell you in that moment, that's not working. No, it's not going to work. Breathing is not going to work. No, you can't breathe deeply. And that's what your head is going to tell you. And that is when it's even more important to breathe. So one of the techniques that I like the best, and anybody can look this up on YouTube, it's Dr. Weil, Weil. It's called 4-7-8 breathing. And it's a great breathing technique. And honestly, whatever breathing technique you have is great, as long as it's deep breaths and it's right into your diaphragm, focused on that while you're trying to get those emotions down. But the 4-7-8 breathing, I just love, because it keeps you focused on. So the way it goes is you breathe in through your nose, counting to 4. you hold it for 7, and then you breathe out with a counting to 8. So you do that for 4 cycles. So the nice thing about this is you can do this a couple times a day. And if you do it for 6 weeks, it'll actually bring that baseline kind of anxiety down in your body, but you can use it as needed, kind of like a PRN. So yeah, 4-7-8 breathing. I love it. And I always recommend you practice it when your emotions aren't high.
Right.
That when your emotions are high, it's not the time to try something new. Practice it when your emotions aren't high. And then when they go up, you can start, what is that 4-7-8? Okay, no, I know how to do that. I've practiced it.
Right.
Because you can push your moods up pretty high if you're trying to, I don't remember how to do this. Right. Practice it, and Dr. Weil suggests doing it twice a day. So I always recommend morning and night, 4-7-8 breathing, 4 cycles. And after, I think it's about 6 weeks, you can do 2 cycles of 4 and just help your body to bring that anxiety down, and then use it as needed. So that is a big one. I can't tell you how important breathing is. And your head will tell you it's not working. So yes. keep going with it. The other thing that I like to say just about bringing those moods down or those emotions down in the moment is sometimes distraction works. So whether it's listening to music, partaking in activity, some people do weights, some people walk or run or anything like that, whatever you can do to keep active. And sometimes not even that can work. So I'll say count down to, from 50 backwards. Do the alphabet backwards. It's giving you something else to focus on, right?
Right.
So, and if you really love music, pick out your favorite song and just pick out one instrument in that song and listen to that instrument. So if it's the guitar, just listen to the guitar, really focus on that guitar through the whole song. It's just another little thing that you can do. There's definitely plenty of exercises that you can do to bring down that emotion, any kind of grounding or mindfulness. And I can't speak enough about mindfulness and the importance of being in the moment and just really grounding yourself in the moment. So those are a few quick tips. Now there is one that if it's really up there high and you really nothing's working to bring it down, cold water. Splashing cold water on your face, or even like an ice pack on your face, just protect your skin and everything with a towel, right? As long as you can tolerate it. It actually simulates the dive reflex, which stimulates that relaxation system to physiologically bring down that high emotion in that moment. So if nothing else is working, there's always cold water.
Yeah. I've seen like ice cube on the wrist, this part of the wrist. We talk about these things, and a lot of times people will say, like you said, oh, not the breathing thing, or not the counting thing, or it sounds simple, but that's the point. Like, it's that simple, so it can be done. It's free, it's simple, and it's something you can do no matter where you are. But it also physically changes the chemicals and the reaction of your body. The cold physically does things to the body that makes it react in a way to help calm it down and to cool it off, especially when it's one of those heat generated, anger or anxiety where there's a lot of heat and anxiety. The cool can help cool it down, just like our emotions. We talk about, I need to just cool down.
Yeah.
The breath work. You talked about how it's so important for our brains to get that oxygen. That's what the whole breath work is about. It's not so much about the breathing and the diaphragm and all that, which is all great, but it gets the oxygen into those cells, into all of the important organs in our bodies, especially the brain, so it can function and think clearly and effectively. So then once you get that kind of lower again, you can turn off that reptilian brain and you can kind of get into a more logical state where then you can kind of talk your way the rest of the way down. But if you're high enough up there and you don't have the oxygen in the brain, it can't do that efficiently or effectively. So I think that's huge to connect the two. It's not just about the breath work and the positive thinking. It truly changes how the body reacts and the chemicals and everything that goes within it.
Yep, absolutely it does. And in the moment, they don't feel simple.
Yeah, they're not easy, they're simple.
But the point of it is to have those tools that you can have a paper when you know that your anxiety goes up or your anger goes up while you're out. You can have a paper, your little emergency paper or notes in your phone that goes through the things that you can do to bring down that emotion in the moment, because you don't think straight. Because your brain tells you lots of stuff when you're in those high emotions.
Yes. And, it comes from where, we come from as a human race. It came from, back in the day, people had to have that fight or flight heightened to survive, to find food, to not get eaten, to run from the bear. That's not, it's a protection. It's our brain trying to protect us from any kind of pain, because it doesn't distinguish between mental pain and physical pain. It's just trying to protect from any kind of pain or trauma. And so it's not a bad thing. It's just about getting that threshold down so it doesn't turn so quick and so harsh on us, that we can kind of get that threshold down so it doesn't fire at I don't want to say the minor things, because they're not minor at the time. But we're not getting chased by a bear. We're not necessarily looking for some food in the wilderness or anything like that. It's very different trauma, but it's still a protection mode that we have. So it's just a matter of learning how to control it and lowering the threshold.
Exactly. Yes, because your body is reacting like you're being chased by a bear.
Mm-hmm.
That's what your thoughts are telling it. And so you're right, just being able to physically bring that down allows you then to take the next steps. So it may be those next steps are sort of looking at a bit more of the positive thinking or things like that. Right. But in that moment when it's high, no.
I feel like so often we talk to and listen to the self-help people, and it's all about, positive thinking. And I truly believe in law of attraction, but I think there's an element to it where there's a point and a time where it's important to feel those emotions and to feel through them, so then you can heal through them. And then is time for replacing it with the positive affirmations. And because if you're thinking too high up that you can't really see, your internal instinct is going to be, you are a liar. You don't believe that. That's not true. And it's not going to do any good. So you have to kind of level up, I like to say, in those thoughts. You're not going to go from the bottom to the top in one step. You have to take those little steps in between. And I truly feel it's important to work through the negative. And it's okay to not be okay. It's okay to cry. It is okay to be upset. It is okay to feel all of those things. It doesn't make you a bad person or weak or anything like that. Feel it so you can work through it and heal it. And then you can change the mentality behind it.
I think we've given moods a bad rap in labeling them positive or negative or good or bad. Mm-hmm. No mood is good or bad or positive or negative. They are what they are, and they're what you're feeling in the moment. So, and that's some of the work I've done, and is really recognizing those moods in the moment. Mm-hmm. And a lot of people saying, well, no, I don't want to talk about that mood. I want to just talk about happy. And we have to say, in this moment, I'm sad at a 6, or I'm lonely at a 7, or I'm frustrated, because it's that awareness and that being in the moment, kind of like the dark side of mindfulness. Being in that moment allows you then to make choices on what you can do to move from that. And I like what you said, and I was thinking about that today. It's okay not to be okay.
I think of when I had a patient, circle the tank, or maybe they passed, or something happens that you get really emotional. I'll even say, that's not the time for me to fall apart during a code, or you're trying to do compressions and trying to save someone's life. You can't. You're right. You have to kind of ignore your own feelings in a moment and do what needs to be done. But you better bet that after that whole pressure cooker is done, or on my way home, I'm crying. I'm yelling, I'm screaming, I'm praying, I'm doing whatever to get those feelings out, because that's human. I know a lot of people look at nurses and maybe we look hard or harsh or like we don't care. That's far, far, far from the truth. We just have to kind of put it aside because we're in the moment trying to save someone's life, or at least we're in a critical state. The times I've cried my way home or had to like take a bathroom break and sit on the toilet and I didn't pee, I just cried. It happens, but we have to be strong in front of people. So there's a time and place that I believe are maybe better times to fall apart than others. But for the most part, get it out as quick as you can, or it's just going to build and fester. And it's just like an infection. If you've got a place of infection on your hand or anywhere else, if you continue to leave it without treating it or cleaning it, it's just going to get worse. And you're going to
It's
get
going
to
to tell you.
yeah. And then you won't have a choice but to go to the doctor, the hospital, and get it taken care of, or they're going to have to chop it off. I mean, it really can get that serious. So our mental health, we do not give it enough credit. Now, let me ask you this. Do you see those who have had extreme mental issues or traumas or things like that? How is their physical health usually?
Oh, don't those go hand in hand?
Yes.
I think so. Here's something that, again, I talk about a lot, or I've talked about a lot in my work and in the programming I'm developing. We develop unhealthy behaviors. And it's because in the moment, it just feels better in that short-term moment. So things like not eating healthy or not brushing our teeth. Because in the moment, you just say, you know what, I don't feel like brushing my teeth today, so I'm not going to.
Right.
And so you don't. And in that moment, you get that bit of short-term relief. But if you don't brush your teeth over weeks, because every day you said, I don't really feel like doing that, your teeth start to tell you there's something really wrong here. So physically, absolutely, that is definitely something that's impacted because you just don't feel like taking care of yourself. And if you think about it, when you're low mood, which is normal for everyone to have low mood in different points in life when things happen, I think one of the first things to go is our eating, our healthy eating, and our exercise and hygiene. Yes, absolutely. You know what? I am tired today. I do not feel like having a shower or whatever. And then one day can become 3 or 4,
Very
right?
easily, yeah.
That is something that happens, and it's a common symptom with mental health challenges. So when you find those things are going on, let that be a red flag to you that there's something more that you've got to go look into, because if you leave it long term, those impacts are going to be long term. So if you aren't eating properly for a few days, that's one thing. When you're not eating properly for a few months, your body doesn't function. And I truly believe the 3 pillars are sleep, activity, and your diet, what you're eating. That's your 3 pillars.
A lot of times when people are struggling with trauma or mental health or anxiety or depression, I did going to the doctor and having all sorts of physical issues that you're dealing with, and they'll run all the tests and go, sorry, everything is coming out normal. And it is so frustrating to be like, this is not normal. I'm not making this up. I am not faking this. I don't want attention. Trust me. The last thing I want to do is have anyone's attention right now. But it's very, very hard to have that come back and, oh, everything's normal. You don't feel physically fine. I wanted to touch on that a little bit, and I think you're dead on.
And the other thing is, when you think of anxiety or that trauma response, when you're in a constant state of tension, your body begins to feel that in so many ways. The chest pain, the muscle pain, the body aches, all of that goes with that long-term just muscle tension from always being in a state of anxiety or stress, or the challenge is that you go into the doctor and you go into the doctor and you go into the doctor and then nope, nothing's wrong. And often that next step isn't taken. Okay, what's going on with you really?
Right.
Because they don't have time. And again, I can only comment on the Canadian or the Alberta healthcare system, but doctors have been given very clear expectations in the family doctor's office that it's a 15-minute appointment, and you're not paid for anything more or this or that, and so they don't have the time to take that next step to say, okay, you've been in here 3 times in the last couple of weeks. We haven't found anything medically. What's going on? Or the alternative thing is, I think you're just depressed, or I think you're just having here's some medication.
Right.
They're sometimes given out like Smarties. I'll fix it all. That a pill just isn't going to fix everything. It's that piece of, just taking one step at a time and getting back into life one step at a time, and then starting to delve into the things that have happened that have led you to where you're feeling the way you are. Try not to let the frustrations with the system, because the systems are frustrating.
Yes.
For anyone to get through, never mind someone who's feeling depressed or anxious or feeling like they don't understand what's going on, right?
So I'm going to ask you the question that I ask everyone here on season 2. That person who's listening, that listener who is really, really struggling and they don't know what to do, they don't know the next step, and maybe they're not even sure that they care, that they want to do the next step. They're just tired and they don't know how to help. What do you want to say to that listener?
I think the first thing I want to say is breathe. Allow yourself that moment. Know that you're not doing well. That it's okay not to be okay. And you're worth it, not just to you, but to all of us that care so much about you. And I'm not just talking about your family or your friends. I'm talking about the people that go into this work every day who just want to see people do well. I'm not going to promise it's going to be easy. It'll be worth it, taking every one of those small steps. And honestly, if all you can do today is get up and get out of bed for 5 minutes, start there. And then the next day, get out of bed for 10 minutes. And then the next day, get out of bed for 15 minutes. But start small and reach out.
And you touched on doing the little things. I've been asked, what was the thing that, finally turned your life around, or what's the one thing that really helped you the most? And I, to this day, still say it wasn't really about the one big thing that I did. It was the little things I did every day. It was the little habits and the small and simple things I did every day that with consistency made the biggest impact on my life.
And I can't speak to that enough. There's a huge thing, and I might have mentioned this already, but there's a huge kind of trend about diving deep and get into your trauma and go deeper, reach into your higher self and figure out what's wrong. And to use an example, I was on a Facebook group, and the gal put on there, I just don't know what to do. I can't get my chores done, and it's all becoming overwhelming, and this and that. And the response that she got from someone was, well, spend time and dive deep and look at what your consciousness is telling you. And all I could think of is this woman just is having a hard time just getting stuff done. Let's start with the first step. Let's just start with the first step and take a breath, take a moment, allow yourself to be where you are, and it's okay. Allow yourself to be okay with not getting it all done right this moment.
Right.
And then take another step. And then when you've taken those steps, like you said, wow, how many steps did I take to get here? But it's amazing that I've gotten here. Then when you've taken those steps, You've learned how to get back into life again. You've learned how to cope with those strong emotions. Then you can start working on that trauma and doing that deep dive. But first, you got to get yourself back on track and feeling better again.
Well, Lesley, I thank you so much for coming on today and all of your great wisdom and experience. And thank you so much for the work you've done in your past and what you're continuing to do in the ways that you can now. And thank you for especially being here while we celebrate nurses this month.
Well, you're very welcome. It has been my absolute pleasure talking with you and talking with your audience and sharing this. And I'm so happy to be here. Take care.
Thank you. Hey, it's Tracy. I'm just here real quick to remind you to please subscribe to this podcast wherever you're listening. We're on all major podcast platforms. Thank you for your love and support. I want to thank all of my guests and helpers behind the scene. I couldn't do it without you. You guys are truly the inspiration that helps me go through this every day. So thank you so much for listening. Make sure you're sharing with your friends, your coworkers, your family, or anyone else you think might be really needing to hear this content on how to heal and overcome from obstacles and tragedies and traumas. That's why we're here, so people can know that they're not alone, get some real good tips on how to better their life and to heal and to really be triumphant in their life and have a life that they can be excited about again. So thanks for being here.